moving on. I think we have a fireside chat, a very interesting fireside chat. I think you'll get to know. Yeah. I would like to invite Dr. Maheshwari, officer on special duty to special duty health to BBMP, and Sendil Kumar Murugeshan, who's the CEO, co-founder of Save Mom. Big thanks to both of you for agreeing for this conversation, because I've been in the startup ecosystem for quite some time. And any startup working for government, I mean, they go with their eyes wide open. It's a huge opportunity, right? But then it's a double-edged sword. So working with the government is a huge opportunity. There are also a lot of challenges of how to make it happen with the government. So I think we thought we will have this interesting fireside chat about with the government, how is the startup working, what are the opportunities. That's what this conversation is going to be all about. I think maybe we'll start first a brief introduction of Dr. Maheshwari. She is a public health expert, especially in the NCD and the geriatric care, a firm believer in technology for health, and is played a very pivotal role in AI tool rollout aimed at monitoring pregnant women's health under the BBMP's health mission, which we are going to deep dive as well today. She's obtained her degrees in medicine from Rajiv Gandhi University and CMC Vellore, and has an MBA in healthcare from IIM Bangalore. I think the first question will be to you, Dr. Maheshwari. With the deep penetration of digital technology, especially the smartphones, right? What is the impact it can have on public health? I think today, on an average, I think every family, whether rural, everybody, at least one person in a family has a smartphone. So, what do you think this will have an impact on public health at large?
For us, technology, for us, BPMP or for any government, it's the smartphone. We don't know other things as of now. So the
Okay.
best thing that I have seen is our ASHA workers able to take the data in a smartphone, removing our pen and paper, and that data fetching, that activity itself is a big boon for us. First thing. Second thing, e-Sanjeevani, where we can give teleconsultation through a smartphone, through an ASHA or without an ASHA also, a citizen can take the services of teleconsultation. So that is one thing. Primarily what I see with smartphones is two things: data assimilation and misinformation, that pen paper manpower error that can be removed, and that I can see in last 2 years when we have given smart tabs to our ASHA workers and they're able to fetch many data, and our analysis part has also improved with it.
Sure, thank you. I think before I come to you, Sendil, I quickly love to introduce. It's always a pleasure to introduce your startup in any audience, because we all talk. At least I say it's very easy to talk from the side, whether you mentor, investor, or anybody, right? But day in and a day out, the guy who feels the heat on the ground is a startup founder, right? So it's always a pleasure to introduce a founder. So Sendil is the founder, CEO, co-founder of Save Mom. It's a healthcare startup based out of Madurai till very recently, if I may put it, right? Dedicated to improving maternal and newborn healthcare through AI-powered remote monitoring solutions. It's made significant strides in reducing maternal mortality in rural and tribal communities. I think they have a lot of numbers to their credit: 50,000 healthy deliveries, a case study featured in Harvard Business School, and also highlighted by WHO recently. Sendil, one fundamental question, right? What inspired you to start Save Mom?
So before starting the company, I worked in the semiconductor industry, so mainly in the wearable division. So I was part of the team which brings this powerful processor into the wearable form with a long battery thing. So this is like one fine day I traveled to my sister for the health checkup. She was pregnant and I traveled to her. What I realized is like more than 50-60 mothers are waiting in the queue. We went at 8 in the morning. The hospital told should not take any food because it's an ultrasound scan. So we were waiting in the hospital for almost 3 p.m. So this whole checkup process completed. So I observed the whole thing. I get a chance to interact with the doctor also. In the industry, we automate everything. There are so many systems we built, automated, manufacturing, even a banking nowadays, everything is automated. But healthcare still follow the very traditional thing. So in the healthcare system, the doctor is there, yeah, a nurse also there, and then there is a laboratory. So these three people still uses the pen and paper based approach. They even have a software, but the problem is most of the software creates a burden for the hospital doctors, because they have to write it in a pen and paper. Again, they have to feed it into the system. So it creates more burden for them. So I closely work with the doctor to understand. My goal is if I able to solve the doctor's pain point, it naturally reduce the waiting time. So even whoever pregnant mother goes, like, they can quickly complete the checkup, and so it allow more visit also. Like right now, especially in a village, that is what we solve. The woman is the backbone of the family. If she want to go for a monthly checkup, the entire family should be in the hunger, because he goes, he can't prepare the food. So most of the women in this remote villages and all, they skipping this ANC visit. So WHO recommending 8, but getting 4 checkup itself very difficult. Okay, then at the last time of delivery, they come admitted in a very complicated manner, and that is where the mortality happening. So in our Maharashtra deployment, what we have done is like we promised every woman within a 1 hour your checkup is will be completed. You will be sent back to the home. You still cook and take care of the family. So that motivated more mother to visit the ANC, and naturally it solves the mortality rate. So this is the reason behind starting the Save
So
Mom.
what are the typical challenges you face? Save Mom is about 6 to 8 years old now. How old?
Almost 3 years we have done a clinical trial, and another 3 years of field deployment. So almost 8 years.
8 years.
Yeah.
So what are the challenges you faced, and what keeps you going?
See, we do it in a private. Initially, we started with a private, but in challenge in private hospital is no Indian innovation is done. So always a private hospital see a global any product you go to the health system, they always refer to the global referral. If it is a no global referral, accepting is very difficult. So this is where we realize that instead of fighting every individual private hospital, we work with the government. Okay, solve this real problem and publish into Harvard, all this Yale top level university, and make a scientific case. Then implementing in private is easier. So that is why we started working with the government. But what as a startup I realized is in Western countries doing this clinical development is very expensive. Without $1 million, they can't even start a health company. But in India, government is very supportive. Okay, they allow you to do massive deployment and validation, and the pain point also there. So you can see after implementation, you can see the impact on the ground visible. That is easy for all the scientific journals to prove it. So that is why we started working with the government closely, and we able to see this impact on the ground. And that enable even now the global players are referring our model, how we have do a cultural innovation, how we adapted technology is there, but until the doctor is not using a technology, our patient is not using a technology is a fantasy word, but how you make them to use it, what we solved it in Save Mom.
So these also came in the previous conversations also, right? The solution has to be customized to the local setting. It's very key, right?
Also, government, public sector itself is a unique customer. The startup needs component needs to understand the requirement of the public sector or the government is unique by itself. Just because you have a product, we won't be able to take it. First, you need to know what is government's pain point and what is the health goal that it is trying to reach. And you pitching in there will be the easiest one to do it. You develop something and ask us to adopt, it's not going to happen that way.
No, absolutely. Because see, running an incubator even now, one of the things we always emphasize is the customer discovery. Yeah. Find out what are the pain points of the customer you're trying to solve. Build something which is scalable.
Government is a unique customer. That's
yeah.
what I mean to say.
Yeah, okay. No, again, coming back to fundamentally, one good thing, I also deep dive on what BBMP is trying to do with Save Mom, because there are multiple initiatives on technology which government of Karnataka is driving, right? I think I heard that there's a fellowship also for people who are now trying to digitize with government and things like that. Can you throw more light on where all is government trying to do around technology for health?
You should ask Sendil how we picked him. Okay. We picked him when he was pitching it some other platform on a television.
Oh, okay.
We picked him. I pitched him and I found him on LinkedIn. Then I picked him, please come to Bangalore. That's how we picked him. When we have the pain, we'll pick wherever you are.
No, especially Karnataka government, that advantage is you don't need to chase them. Okay, they respect innovation, and they are the first one who want to be experiment. Okay, compared, I feel like always like Karnataka government from the elevate 100 days, they always the first one, because in India, the problem is innovation is very new thing, startups and all. We naturally buy a mature product. Okay, no customer ready to buy a immature, halfly developed product. But in Karnataka, the advantage is they are ready to understand the halfly developed. They understand this is a halfly developed product, but we might be your first customer. Experiment with this, shape
Co-create
it.
with
Yeah,
the
go
customer.
create.
No. That's because the already developed products are not ready to tailor to our situation, to our problems. So we have faced this during COVID. I think Karnataka government pre-COVID and post-COVID, they're totally different. So COVID has taught us a lesson, and we have also felt that during COVID also we built our own systems. We were the first one, and our model was replicated all over the world. I mean, all over country also. So like that, Karnataka always believes that our problems are unique, and we want to tailor the solution for ourselves.
Okay. So what are the kind of technologies that you're trying to work
Right
around?
now, at health prospect, health and sanitation, some of the very, very innovative ones are one is Save Mom. One we are doing for dengue ward level monitoring system where we can predict exactly at this street. Last year, this was the dengue instance. This year, this will be the dengue instance, and we need to do fogging, all such activities.
Come.
At that level of micro data analysis, we are doing at the ward level for particularly vector-borne disease, specifically for dengue. And for sanitation purpose, I know if I vocalize this, people may not accept, but give me like 2-3 months time, you will see the difference. We have developed an active chatbot for solid waste management, which was launched, I think, 10 days or 12 days before. I can give that number. Please raise all your waste issues. My road is not clean, kasta tagond hogila. Raise all your issues. If we don't solve it, please ping us on social media. We will resolve it. There is an active chatbot. I can share that number. It's on website. You can also take it. It leads you a few questions about 3 clicks or 4 clicks. I believe number of clicks. The citizen should have less than 5 clicks to raise his grievance is the question. So,
Ma'am, here I want to add one important point. Actually, government is doing a lot of initiative. This is where the government and startup marriage is very important, because the strength of the startup is they will take that to the end customer. Government launch the scheme, government launch the policy, but government role is not to take it to every individual. Okay, this is where the collaboration can happen effectively, because startup understand individual customer, their strength is taking to everyone through.
Senil, here,
Yeah.
can you throw more light on what you're trying to do with Save Mom and BBMP? More detail.
Yeah, ma'am. Here in Bangalore, what we are doing is almost we have a 2 lakh AN mother in Bangalore. So our goal is introducing
2
this
lakh what mother?
AN mother, pregnant mother,
Pregnant.
that's
mother.
our pregnancy rate per year.
Yeah, every year around 2 lakh, one of the highest in the country also. So our one of the main objective here is government has a lot of schemes, putting it in end user usable perspective. So we launching an application along with the wearable device. So all this mother going to get this one, and the system will track. Even they can go to the private hospital, public hospital. We try to integrate into the single system, and central and state government has a lot of policy. So our idea is how mother can access this policy and get the benefit out
Then
of
how
it.
many wards you're doing this specific
We
project
started
with
a pilot in 2 ward, and now the entire Bangalore we are deploying it. That's what the next process we are doing
We
it.
introduce them. This project is introduced under our brand Bangalore project. So we piloted in 2 wards, specifically given 2 wards where he should fail. We wanted him to fail such that we can succeed. So, but he's been successful. Particularly given a ward where migrants were very high, and people take half services from us and half services from private sector, and we don't know what are those half services they have taken and how do we monitor. So we've given such areas to him.
Yeah, one of the pain point, like in our pilot, what we understand is this mother will go to the government system, enroll it there, okay, and then they disappear from the system. Okay, then they'll go to the private hospital. When the mother become very complicated, they understand this mother has a high mortality chance. They refer them to the GH at the time of delivery. So the mortality happens in the GH. But in their system, there is no record. Like they registered and suddenly come for a delivery. What happened throughout that pregnancy? So that is what we try to solve, the complete transparent system. They can go to the private or public, but the system tracks them, ensure the ANC is done for the mother in a regular basis.
And also the system gives an alert for us that this ANC is going to be high risk ANC.
Yeah, so that is
Such
the
that
AI
we
tool
At
we
least we
implemented.
can, as he was mentioning, the doctors can focus on the primary high risk cases, if not on everybody.
So we are giving some kind of a heat map for the entire Bangalore ward, which location has the high anemic. So the ICD department, Integrated Child Development Department, they can provide the iron rich nutrition to those area. Currently the nutrition is very common to all the mother, but now with this data insight, we can say this area has a high potential anemic mothers, then the nutrition can be given iron rich nutrition personalized to those mother. So this will really solve the
No,
problem
no,
of the,
absolutely. And to be very frank, Senthil, I think one of the reason all this is happening because of officers like Dr. Maheshwari who are there.
100%, 100%,
Nothing like that.
100%.
No,
No,
If not me, somebody will be there.
No, honestly, I think
Never
one question
personalized.
I have for you, Dr. Maheshwari, see, I have been in the ecosystem for quite some time. Lot of startups, as you rightly said in the beginning also, that they build solution in isolation, then they realize this is not what is required, right? To make it more meaningful, to make the conversation more meaningful with the government, with innovation ecosystem, what do you think can be done? How can startups meaningfully engage and build solutions for public health?
First, understand what is the government's goal for health. What is their specific goals? Like, for example, Karnataka is aiming to be on the last for MMR. So that's one of our goal. So first, know what goals we want to achieve and then align with it. And that is the best way to do it. And technology wise, I don't know about other states. Government of Karnataka and Bangalore are open to embrace things. And if you're ready to take the pain of piloting yourself, after that we might support you.
No,
We have done that to him also, that's why.
no, that is up to the startup how, because see there are separate department which give the grant. There is a separate department where ready to avail the pilot. So you should be smart enough to get the pilot order from them, apply to this department to get the grant, match it, run and sustain. Instead of you complaining the system, if you understand how to navigate, this is good. And another thing I want to see, we when we worked with them, we felt like we are working with some kind of a enterprise customer, because they created a group and they have a regular call and they understand. Sometime what happen is, inside the system there is an issue, like some people are not working. We as a startup hesitated to tell, if this is are not working, like no, we can't tell, this is not our problem, some people in our system is not using properly. But you hesitated because you don't want to blame them. The officer will open up, everything is going nice, that means some people from our side not working, so they open up the question and allow you to communicate in terms of commissioner level. So when we say that there is an alternative system, they have to solve the problem, because otherwise this pilot never gets succeed. You do a pilot but pilot will fail. Okay, but they are open to understand, okay, in our side also some challenge, you don't need to worry about it, we will fix it for you, put an additional resources and solve. That is why we able to move from pilot to the commercial
No,
deployment.
very interesting, because healthcare is a long gestation cycle and many startups end up doing only pilots eternally.
Exactly.
Good that you are also scaling up, right? Maybe one or two questions we'll take from the audience
Yes,
as well, right?
yeah.
We have time, I think another 5 minutes. Any one or two questions from the audience, if there are questions?
Question specific to Maheshwari. See, one of the challenge we face in today's system, especially when you talk about Karnataka government's cooperation, I want to know what kind of innovative collaboration is happening to provide the requisite preventive healthcare kind of an identification for senior citizens, especially those couples or senior citizens who are living alone, who doesn't even have an ability to understand the usage of smartphone. So what kind of initiative is the BBMP is taking care, or is there any thought process to collaborate with any kind of a startup ecosystem to identify what can be done? Because that's, I still feel, is a gray area where there is a lot of challenges on both the fronts. So that's primarily my question.
I agree with your question, and I myself am want to do something in the geriatric area. But presently, the national health goal doesn't incline towards that. Right now, we are still at communicable diseases, mother and child, and we are not even moving till non-communicable diseases. Slowly, the shift is there towards from communicable to non-communicable. Right now, what we are doing for geriatric age group is giving some assistance to them, like direct benefit for money transfer or something like that. On health side, we are piloting one project where we are going to screen 1 million aged 60 plus for their non-communicable mental health substance abuse. So this is also in the pilot line. And very shortly, I will be talking about this on that project somewhere else. It's been successful and we are going to fund it. So that's also there. We're going to map all of them. Thank you.
During COVID, there was an app called Arogya Setu, right, which was tracking communicable diseases and alerting people on a smartphone. Now nobody is using it. I wonder why, because so much effort went into propagating it, everybody having it on their phones, and you know,
No.
that can be a huge data point, data set for any kind of AI analytics that can happen for healthcare improvement.
No, I have been a part of developing that app, so I know the pain. I also feel the pain that system we have built are not functional for other communicable diseases. That is also that's also reason being that was a pandemic, and everybody were inclined towards getting the data and using that. I take this idea of using this for my other communicable diseases instead of developing one more app.
Because then everybody will have to download that app, and that's going to be a huge challenge.
Yeah, I take this point. I take this idea actually, to be very frank, and I'll see what can be done. But right now we are not using that. Two reasons. One, it is. Do you know who developed it?
No.
It's developed by. Not known. Not a private sector. It's developed by Government of India. They are not open for us. So we cannot have any API integration. We cannot do push and pull with them. So we are developing our own such that we have an integration with all other our applications. That's also one of the reasons why we are
You're
developing.
part of the government, right?
Yes. No, but why I'm saying is some systems developed, they are not allowing us to interact.
Okay.
So,
And
like
so you can give that
RCH.
feedback to government.
Yes.
Saying,
Yeah,
See, in
right
this
now,
case
especially.
also RCH2 right now.
Yeah. See, basically, there's a RCH portal, Reproductive Child Health Portal. There's a central government portal. See, central government has one system.
Correct.
State government has one system. Initially, this don't communicate, but central needed data. But they because every state in India is different, very unique. The culture is different. Okay, but the system is generated in a top level approach. Arogya Setu also generated in a very top level approach. It's not allowed state to modify it. That's why startup like us, even a government, we pushed them for RCH 2.0. There's a new version they are giving.
Finally, they have agreed.
Yeah, finally agreed. So what we have told them is, you don't need to give me a system. Just to give me an API interface, I will do the custom development and integrate. You need a data, we will give a data. So that is why now happening in RCH ID. Similar thing can happen on Arogya Setu.
Similar thing is also happening at our IHIP portal, that is Integrated Health Information Portal, which is the portal for all our communicable diseases. We are actually pushing that. Maybe another 6 months, we might have a good news, because they have unofficially accepted. So I'm waiting for an official mail. But it's a good idea. I take this idea, and I also feel there should be a single platform for citizens not to get confused.
Yeah, because there will be people traveling across states and across also, but at least if we can have some common app within the country, that will be
the future will be the ABHA number. ABHA number will be the future, what you're seeing. And ABHA as of now is just a unique health ID, something of Aadhaar types. But they will futurely develop all this into it. ABHA number is going to be a unique ID for all of us.
I think lack of time, I think we'll close, yeah. As the next speaker come. Dr. Mahesh, quickly, if you can close this, yeah.
BBMP was the one who developed the public gym system in 2012 in collaboration with Simnimhans. So BBMP has also developed one for non-communicable diseases. That's what I was saying. We are going to have a health bank kind of a thing, where we're going to have preventive health records of all the 1 million population, and ask the citizens to invest 1 rupee per day. And we are going to give preventive health checkups in future. It's still in pilot, so let it become successful for me to talk.
Thank you so much. I think it's wonderful. Thank you. Thank you, Senthil.
Thank you, panel, for that wonderful session. And I call upon Mr. T.R. Anand, Charter Member of TIE Bangalore and Chair of Matrix Forum, to give away the token of gratitude.
Dr. Lakshmi, can I have 2 minutes, 1 minute? I just want to highlight that encouraging startups to work in this sector is very important. And I feel very proud and I'm very happy that Senthil here, Save Mom, was our Matrix Award winner 2 years ago. Okay, so at that time he was in 2 states, and now you've seen how they've progressed and really contributed to public health. So we will continue to encourage startups and facilitate them. So that's the first announcement that I wanted to make. I'll take another 2 minutes. This is regarding Bangalore and BBMP. You have another session with Dr. Srinath now, but after that session is over, please come over to the main arena. We have another BBMP related urban mobility in Bangalore session happening with a panel including the Joint Commissioner of Traffic and the BMTC Chief of Operations. So please come there if you want to improve the traffic and the mobility and look at the future of mobility in Bangalore after the next session here. Thank you. Thank you for spending your time and really coming there.
94481 97197. BSWM 94481 97197. Please test us.
Dr. Lakshmi is our chair of our healthcare and really doing a wonderful job in taking care of healthcare and setting the theme for today's session. Thank you.